Good evening everyone. Today we will discuss about angina pectoralis. What is this angina? It's sharp pain during morning. When the patient gets up, he gets sharp pain on the chest. So angina, it is classified into two types. One which is classic, this is also called exertional, or it is variant angina. This is also called Prince metal angina. Or vasospastic angina. What happens in both of these? These are coronary arteries. The major difference is one, in the classic variant there will be some thrombus which is the culprit. This thrombus will not allow blood to pass through this properly in the morning, because in the morning there will be vasospasm. So this can cause ischemia. And increase workload, which will produce pain. On the other hand, the Prince metal, there will be narrowing. The arterial wall will narrow, so there won't be enough space to move the blood. So what we do in pharmacy, in drugs we give nitrates which will decrease the preload. Second, what we can do, we can give calcium channel blockers, can give beta blockers to decrease the working activity of the heart, or we can give potassium openers. So one by one we'll discuss about these drugs. First one about nitrates. How the nitrates help. Nitrates, they will increase cyclic GMP. This will produce action on the vessels and cause vasodilation. In this, what will happen? This will do vasodilation in veins more than arteries. So that's why it will decrease the preload. So now drugs of nitrates. GTN or NTG. This is glycerol trinitrate. This is also commonly called nitroglycerin. Nitroglycerate. Second, what we can use, that is IDN. What is this? Isosorbate dinitrate. Then number 3 we can use IMN. This is isosorbate mononitrate. Fourth drug, PETN. This is penta erythritol tetra nitrate. Fifth, AN, amyl nitrate. So in these drugs, this GTN or glyceryl trinitrate or nitroglycerate or isosorbate dinitrate this can be given as sublingually. Under the tongue. What are the advantages giving sublingually? When the action is over or when the patient is recovered after the pain, you can spit it out. This is the main advantage of sublingual drug, and this can bypass all the metabolism. This can be used as fast. In this isosorbate mononitrate, this is having minimum first pass metabolism. PETN, pentaethylate trinitrate. Pentaethylate trinitrate have longest action. Then AN, amyl nitrate. Amyl nitrate have short action. These are the some important things about the drugs. Now something interesting about this topic, which is called nitrous free period. What is this nitrate free period? Nitrous free period, in this, when nitrous is given in the body, this will increase cyclic GMP, as we have already discussed. Cyclic GMP, this will lead to vasodilation and decrease this preload. Which will decrease BP. But If we give or somebody by mistake takes sildenafil, what is this sildenafil? It's more popularly known as Viagra, which is used people who have non-erectile erectile dysfunction. So what sildenafil does? Sildenafil blocks PDA, phosphodiesterase. What it does, phosphodiesterase breaks GMP, sorry. So if it is blocked, lot of GMP will be there in the body, and this will lead to too much vasodilation, and the person may pass out during orgasm. This is one interesting fact. One more thing is there with nitrate free period tolerance. If person is using nitrate in morning, in afternoon, in evening and at night, so we should not give once at night, remove at night. This is called nitrous free period. We will take in morning, maybe afternoon, evening, but not at night. So once you need to, when the body is at rest, better not to give nitrate. So it can cause vasodilation, decrease in preload and severe decrease in BP. Decrease in preload and severe decrease in BP. Now about the next drug, calcium channel blockers. Really there are two types, L type calcium channel and T type calcium channel. This T type present in thalamus. L type calcium channel is found in CVS and T type in thalamus. So we block only L type calcium channel. So there are three major drugs and there are some subtypes, which is verapamil, diltiazem, and DHPs, dihydropyridines. This ends with dipene. All the drugs which ends with dipene. Nifedipine, amlodipine, nicardipine and clavdipine. So let's compare these three. Number 1, verapamil. Diltiazem. And DHPs. What will be their work? In blood vessels and in heart rate. In blood vessels, this all three will do vasodilation. And decrease diastolic blood pressure. In heart rate, there is slight change in heart rate during expiration and during inspiration. So during expiration, by verapamil it decreases thrice, but during inspiration it increases heartbeat once. Diltiazem, they decrease twice, in inspiration once. Dihydropyridines, dipines, all dipines do not change anything in inspiration, but increases in inspiration. So the net result, heart rate can be decreased twice by verapamil, heart rate can be decreased once by diltiazem. By dipines, they do not decrease, they increase heart rate. So what is the reason we can give here? And dipines, compensatory response. By sympathetic activity. Now we are done with calcium. Potassium channel openers. Let's talk about potassium channel openers. Potassium channel openers. Nicorandil. See, at the end they end with dil. Dil means heart, so it is used as angina, used in angina. But nicorandil, this have dual action. This is potassium channel opener, plus in this name they have nicorandil, NO. So this is nitrate restorer. nitrate releaser. So it can work as potassium channel opener and plus nitrate releaser. Fourth drug, beta blockers. So you know beta blockers. There is beta 1 receptor and beta 2 receptor. Beta 1 present in heart. Beta 2 is present in arteries. So what will happen if we block beta 1 receptor? If we block beta 1 receptor, it will decrease heart rate. If we block beta 2 receptors, it will do vasoconstriction. So this is beta 2 blockers are contraindicated in variant angina. This one will reduce work. So this can be used in classical angina, where there is a clot in the coronary artery. So we are done with all the 4 type of drugs, what they do. Beta blocker drugs we have already discussed in CVS previous video, so I am not telling, all ending with lol, carvedilol and all these drugs. So now we'll talk about some new drugs. Bradycardic agent. Number 1, we are talking about bradycardic agent. A drug named ivabradine. This works This works on sinoarterial node. What it does, in sinoarterial node there is sodium channel which is activated by a funny current. This is called funny current because they have automaticity. This channel is open. During hyperpolarization. So normally it increases heart rate. But what happens with this Ivabradine. Ivabradine blocks this sodium channel. Leading to decrease in heart rate. This is the mechanism of ivabradine. But major side effect of ivabradine is decreased visual acuity. This ivabradine, which decreases heart rate, can also be used in congestive heart failure. This was the first new drug. Second new drug is Rho kinase inhibitor. It is Rho kinase inhibitor. What it does? Rho kinase, this one blocks vasoconstriction in the vessels. Actually this does vasoconstriction, but inhibitors will block the vasoconstriction, so it will do vasodilation. So it is used in angina. Drug name is Fasudil. Again Dil. Dil means used in angina. Third drug, which is metabolite modulator. Normally what happens? Glucose plus oxygen gives ATP. So if we give one glucose 100 oxygen, so it will give 100 ATP. There is another metabolism or metabolite, fatty acid. Fatty acid, with use of 200 oxygens, it can give only 100 ATPs. So we generally heart uses fatty acid, so we shift the metabolite to glucose. What are the drug? Trimethazidine, ranolazine, so that decrease of oxygen or oxygen requirement decreases for myocardium. One more speciality about ranolazine is it also blocks sodium channel, or it can also act as sodium channel blocker. Ranolazine. There is a small topic about MI. Myocardial infarction. What is the difference between angina and myocardial infarction. Angina, it is myocardial ischemia. This is, the name only says myocardial infarction. Infarct, that means dead. So this is not reversible. This can be reversible. So in MI, myocardial infarction, when it is not reversible, we can classify into non-STEMI and STEMI. What does it mean, STEMI? ST, elevated myocardial infarction in a ECG. This is non-ST, this is ST elevated. So in ECG, what you can see, there is a P wave, Q, R, S and T wave. So this S to T, this is called ST segment. So in this there is no ST elevation, but there is ST elevation. So drug in both of them we use similarly. For remembering the drugs, we will remember one name, which is name Mona. In non-STEMI we use Mona. Mona is morphine, oxygen, nitrates and aspirin. On the other hand, in the STEMI we use S and from the opposite side sonam. Here you can see M-O-N-A are same. For the S we use one extra drug, which is streptokinase, only used in ST elevated MI. These are the same: oxygen, nitrate, aspirin and morphine. So thank you for listening and paying attention.